Welcome back, everyone. Well, we're talking about thalassemia and blood conditions, and this is one of them. We still have with us Dr. Waleed. Thank you very much, from the Fatimid Foundation. You were saying earlier that the urine is dark. When you say dark, do you mean brown, yellow? When you say dark, what exactly?
It is the yellow tinge is more. Normally, right. It is dark yellow.
Okay. And one of the things I have on my list here, of course, is bone problems. Especially bones in the face. What does that mean?
Okay, because there is a lack of oxygen carrying capacity, then the body responds, and the major response is that the bone marrow that expands, because more bone marrow is the factory of producing red blood cells. So there is a stimulus for the bone marrow to expand, and these flat bones, they have the bone marrow. So when the bone marrow expands, there is a bossing of the forehead, there is a prominence of the malar region, and also there is a thickening, thinning of the thigh bones, because the bone marrow expands.
When does this become visible? At what age?
When there is a lack of blood transfusion, even when people are getting blood transfusion but not proper blood transfusion, and then this body will keep on the stimulus of producing more bone marrow. So it may continue over years. So normally, as I had told you, that if the child is not getting blood transfusion, he or she will be die before 3 years of age. So by the time this, if she is not getting blood transfusion, by the time these signs are appearing, she is almost dead.
Miserable situation.
Yes.
But I know that in our culture, we tend to, as a cultural acceptance really, have inter-cousin marriages.
Right.
How does that affect thalasssemic patients? I mean, my understanding of this is, again, a layman mathematician, is that you are really driving up the risk level when you do something like this.
As there was research done in 2002, and the paper was published in the British Journal of Medicine, and the research was done by Dr. Shoaib. He showed us that 31% of the family members of the thalassemic child are the genetic carriers of this disease. Right. So if the general population is carrying 5%, then this means that 6%, 6 times the risk is higher for the thalassemic child to born to the families with intermarriages than the general population. So you are definitely increasing the risk.
Substantially.
Yes.
So in your view, cousin marriages should be discouraged?
Well, if there is actually there's a case of thalassemic child in the family, then definitely they should get themselves screened for thalassemia status. Once they have that result, then the elders can decide whether thalassemia minor should get married to a normal person or. But as a general rule, yes, of course.
Stay away from it. It's a good insurance policy for your health and safety.
Right, but no, it is not a guarantee that you will not be a parent of a thalassemia child, even if you marry outside the family.
Why?
Because still there is a risk of you being if a thalassemia minor, then there is a risk that you, 1 out of 20 will be a carrier. There is a risk that you will marry that person, because in my hospital, in my center, there are people who are not blood related, but still they have thalassemic child. So the important is that when you are going to get married, you get your blood tested for thalassemia status.
Always.
Even for the other diseases as hepatitis and other things, one should get
as a matter of course. That's what you're saying. As a matter of course, you should do it anyway.
Yes,
we touched a little bit earlier on, Dr. Waleed, about the cost of this. I happen to have, and I don't know if my colleague is watching right now or not. I hope that he is, and that he understands my compassion for him and his situation. I have a colleague that I used to work with that had 2 thalassemic children. And I watched and I worked with a gentleman for 13 or 14 years. And I watched first as his children were born and then diagnosed with the illness. And then I watched as they grew up, and I slowly watched the man become bankrupt and eventually have to leave his country, Pakistan, move to the Gulf, be removed from his wife and his children in an effort to earn enough money for these very, very expensive medical treatments and transfusions. Right. Is there a way that you can say maybe that up until this point it's worth treating, and beyond this point is going to damage the rest of the family? I mean, can you make a judgment call like that at all?
No, not at all, because you can't put any monetary figure on life, and because these thalassemic children are living, and then we have to do all our best efforts to give them the best quality life that each living person deserves. Having said that, the only solution I see is that it is the prevention of this disease, because although their cure is available, that is bone marrow transplant, which is very expensive, 1.6 million rupees, and the results are not 100% guaranteed. So, but the prevention is the solution, because even the developed countries like Italy and the Cyprus, although they have the finances to treat a thalassemia patient and give them a good quality life, they worked on the prevention. These population were carrying, they have the 18% carrier rate.
Oh, much greater than ours.
Yes, much greater than ours. But now they don't have any case of thalassemic child born to their population. Only the immigrants who are coming from the third world countries have the thalassemic child. They prevented thalassemia by having premarital screening. Without that screening, they don't register marriage. So a couple has to go through the screening process. If both of them are thalassemia minor, their marriage is not registered. Even our neighboring country, Iran, is doing the premarital screening. In Iran, they screen the male person, and if he is the thalassemia minor, then carrier, then the female is also screened, and they don't allow two thalassemia minor to marry. So their program is very advanced, and they're preventing the thalassemc children birth in Iran. We hope that the government of Pakistan will be also initiate such a program in which they provide the diagnostic facilities at the tahsil level, so that each and every potential person can get their screening thalassemia status screened. So, and I would like to give you a good news that Planning and Development Department of Government of Sindh is in collaboration with Fatimid Foundation is running a prevention program in which we are screening the family members of the non-thalassemic patients. And up to now we have screened more than 3,000 members of thalassemic patients, and out of them 31% has the... Be
consistent with the figures.
Yes.
And how expensive is the screening process?
Screening is quite expensive. We'll need a lot of funds, but the normal test, it costs around 500 rupees. We are doing it on HPLC, that is the gold standard for testing thalassemia minor. So it costs around 500 rupees.
But it ensures your future.
If you look at the financial cost of this disease, it is if you treat 100,000 patients, it is around more than 11 billion rupees per annum. And also you required at least 2.4 million unit of blood to treat these patients.
These numbers are just staggering, absolutely staggering.
On the other hand, the Pakistan is collecting only 1.5 million units of blood. So this is the area is also a lot of should need a lot of attention from the government, that they should create awareness of blood donation, voluntary blood donation, create awareness regarding blood donation, so the people can donate blood and we can help those children with thalassemia.
Well, you've certainly driven home the point as far as screening goes. We appreciate that. For the parents and of course the families who are subjected to this, empathy from the TFB and the team. The rest of the team is with you. And Dr. Waleed Azhar, thank you very much for joining us.
Thank you.
This was enlightening, as you know. I hope that it has enlightened the audience as much as it has enlightened me. And I hope that my colleague and some of us who've had other people suffering from this have seen the inspiration that's gone into today's program. So thank you again, and we'll be back after this.